Okay, hi, it's Dr. Buford. We're just getting started on the right knee here. This is the medial compartment. Can you turn our light source up to 100%? And you can see the articular surfaces look pretty good so far. This is the meniscus, kind of the anterior horn right here looks good. The body here looks good. Hold the camera just for a second. And now we're going to look back here. And there's our tear. Can you turn up the brightness on the box above that? Yeah. Okay, great. So there's our tear back there. We'll put a probe on it just so we can demonstrate it a little bit better. You can see this is all torn here. And this is what we were talking about in the office, that this just is continuing to cause symptoms for you. See that? See how this can flip out? And so that's not awesome. And that's why we're here. So we'll get to work on this and show you some more in a minute. Okay, I just want to show you where we're at. We've taken out all that meniscus that was torn, which is a fair amount of the posterior horn. But like we talked about, you'll be fine. We've got a lot of little regenerative medicine tricks nowadays that we can use to help you if need be in the future. But at least now we know that we can get you back to doing most everything you want to do, I would expect. And so we'll stop there. I'll show you some more in a minute. Okay, so this is the patella, or your kneecap at the top of the screen. I'm trying to focus this picture a little better. And over here on the medial facet, hold the knee for me so it's pointing straight up. So over on the medial facet, that looks pretty good. Here's the central part of the femur. This is called the trochlea. Just a microscopic little fissure there, not bad at all. And all the way down to the central part of the knee here, that cartilage looks pretty good. We can turn on our shaver a little bit and see if there's anything loose, but even that little area right there is not particularly loose, maybe just a shade. And then we'll look over here at the lateral facet. And that lateral facet looks pretty good. So one of the other things we can do is we can look down the outside of the knee, make sure there's no hidden loose pieces of meniscus or anything. That looks good. All the way back. That's the popliteus tendon. Lateral meniscus there. That looks normal. Okay. You can let go of the leg for a minute. And now we'll come around and we'll look on the medial side. And then we'll be done. So here's the medial gutter. And as we look here, that looks pretty good. So we'll take one more look around the knee. We always kind of have a final walk around. I don't think there's anything else we have to do surgically, so I think this will be the end of the video. So I really hope this does the trick for you now. I do want to show you one more thing. Oh, that's it. Actually, we're good. Okay, so good luck to you now. Bye-bye. Okay, so this is the lateral compartment. Let me see if I can get this in. And just a minute here, go ahead and turn off the outflow on the scope. And I'll push down on the knee. Okay, great. And so as we get in here and have a look around, straighten the knee a little bit. Okay. Yeah, so that looks pretty good. So there's the lateral meniscus. Nice, well-defined inner edge. No signs of any significant tearing. There's our shaver that we're just using for suction right now. I'll show you some more in a little bit. Okay, I think we're done here. We've got the meniscus taken care of. The cartilage looks pretty good. We're getting a good picture of that in case you ever have to reference it. So that's the tibial plateau below, femoral condyle up above. This meniscus is stable here. It's attached to the capsule. We'll look in the central part of the knee. This is where the anterior cruciate ligament is. This looks fine. Let me get my shaver. There it is. So this looks fine here. Posterior cruciate ligaments to the right of the shaver behind this little fat pad here. We'll have a look in the lateral compartment next and show you some more.